late diagnosis and misdiagnosis continues being the greatest impediment in stopping the surge of cancer in Kenya and most African countries. Such is the story of Rael Oye, a breast cancer patient who now narrates her painful ordeal and the day-to-day challenges she is forced to endure from her condition, which remains untreated as she lacks the financial muscle. Our reporter Elizabeth Atieno caught up with Rael and now paints a real but grim and painful picture of breast cancer patients.
In Nairobi's Kawangware area, we are accompanied by nurse Elsie Gitugi as we walk through this narrow corridor that leads us to Rael Oye's humble abode. Rael is a sad woman who at most times gets immersed in deep thought. When you carefully look into her eyes, all you can see is pain and anguish as she tries to hold back tears. The most painful part is that this has been Rael's life since the year 2020, when she noticed something peculiar with her left breast. Rael's condition got worse by the day, and what was once a normal lump on her left breast grew into a painful wound. Rael would then embark on various trips to more than 3 hospitals, all coming with different diagnoses.
Niliona kama hii matiti ingine ni kubwa kuliko ingine. Na ilikuwa tu kubwa, ukishika, usiposhika vizuri huwezi jua kitu iko ndani. Ilikuwa tu kubwa yote. Huwezi jua kuna kitu ndani. Lakini nilikuwa nashika, nikishika ingine naona tofauti. Nikishika ingine naona tofauti. Kasema hapana, wacha niende hospitali. Nikaenda hospitali ya kwanza, ilikuwa kwa Madhare. Wakanipima, wakanifanyia ultrasound. Huyo daktari akaniambia ananirufaa Mbagathi. Vile nilienda Mbagathi wakanituma Kenyatta wakaniambia niende pia nipige ultrasound. Nikapiga ultrasound nikawapelekea. Vile niwapelekea wakaniambia nirudi tena wanifanyie mammogram. Nikaenda wakanifanyia mammogram. Mammogram kuitoka ikaonyesha hakuna chochote. Ni matiti tu bure.
Until months later, when her worst fears were confirmed.
Vile nilitoka kwa mammogram wakaniambia vile hawajaona chochote, niende wanifanyie biopsy. Vile nilienda wakanifanyia biopsy ndio ilienda ikatoa, wakasema iko na cancer.
Rael's story is a replica of many others who now bear the burden of late or misdiagnosis of breast cancer, mostly due to, among other things, misread mammograms, which is considered a medical malpractice.
Hizi kemo zingine nilichukua session 6, lakini zote zilikuwa zimebeba 18. Nilikuwa naenda kila wiki. Mpaka zote 18 zikaisha, lakini hakuna mabadiliko.
Rael is not only forced to endure the pain but also the pungent smell emanating from the blood and pus oozing from the cancerous wound.
Matiti ilirudi ikabust. Ili bust ikafanya kidonda matiti yote. Sasa matiti huwa inatoa usa ikimaliza damu inaanza kutoka. Sasa inabidi niende hospitalini wanidress. Na fare kwenda hospitalini hakuna. Pesa ya kulipa hospitalini hakuna. Sasa nilienda hospices na hospices huko ni mbali. Wakanifundisha jinsi yenye naweza dress hiyo kidonda. Sasa mwenyewe wana dress ya kwa nyumba asubuhi na jioni.
Elsie Gitugi is a palliative care nurse at the Nairobi Hospice. Gitugi was tasked with looking after Rael ever since she joined the facility last year, and now narrates her treatment journey, which has proven to be an uphill task due to the financial constraints with little or no interventions from the NHIF.
Once in a while she would buy the mara moja from the normal shops, but of course cancer pain is really very high. So the mara moja would not clear the pain. And we started the pain and other symptom management, which so far we've done well. She uses them at home.
Sasa vile niliambia daktari hakuna mabadiliko, akaniambia niendelee tu na Herceptin. Nikamwambia daktari hiyo Herceptin iko very expensive, mimi sitaendelea. Alikuwa ananiambia nichukue kadi ya bwana na kadi yangu. Nikamwambia mimi sina bwana, niko tu na kadi yangu peke yake. Natumia tu kadi yangu peke yake. Sasa ikiisha mimi sioni njia nyingine. Juu pesa ameshanichangia, nimeshatumia, saa hii hakuna. Kaniambia sisi hatutaki kujua, wewe bora uendelee. Uendelee na Herceptin. Usipoendelea na Herceptin, hiyo ni shauri yako.
Breast cancer is the most common type of cancer in Kenya, mostly affecting older women in urban areas as compared to rural areas. Dr. Nicholas Otieno is an oncologist at the Nairobi Hospital and now explains why this is the case.
Data that comes from the rural areas seems to suggest cervical cancer. Data that comes from the urbanized areas seems to suggest that breast cancer is number one. So it looks like lifestyle of some sort that the urbanized face may be more tagged to breast cancer, and then the rural lifestyle is more towards the cervical cancer.
However, not all hope is lost for breast cancer patients, as different forms of treatment, including surgery and chemotherapy, have proven effective with time.
It's a bit worrying that most Kenyans are not going for screening and they are presenting with late stage cancer. In fact, I would say 60% are coming in stage 3 and 4. So we still have a long way to go.
Cancer is the fourth leading cause of death in the world and has so far claimed over 46,000 lives in Kenya. Some of the signs and symptoms of breast cancer include any change in the size or shape of the breast, pain in any area of the breast, nipple discharge other than breast milk, and a new lump in the breast or underarm. Regular exercise, limiting alcohol consumption, and breastfeeding children, if possible, reduces the risk of getting breast cancer, which affects both men and women. Elizabeth Atieno, TV 47.
Thank you so much for highlighting this story, Elizabeth. If you're willing to help Rael in any way possible, you can send us a message at 22047 and we can link you with her. Let's